Hello. I'll try and keep you energised and interested for the next few sessions. And I want to talk to you a little bit about this. I'm not going to talk a lot about the 6 Cs, but I am going to talk a bit about mental health nursing and some of the issues and some of the facts around it. I'm not sure exactly what you've covered today, but hopefully it will be useful and meaningful in terms of your careers and your future. I want to just kick off by saying, how many of you have read the NHS Constitution? Okay. And how many of you have heard of it? Okay, so that's a few more. And please be honest, don't just say this because it's me. How many of you have heard of the 6 Cs? Okay. How many of you try and use them in your practice? Okay, so I do that because one of the reasons I developed the 6 Cs was because when I was talking to students and to registered nurses and midwives when I was applying for this job, which is about just over 3 years ago now, many people were telling me that they needed something simple and meaningful and tangible that they could use, that they could actually apply to their practice, but also enable them to describe the work they do. So I'm quite clear that the 6 Cs aren't the be-all and end-all of everything, and there are lots of other things that you can use along the way, but they are a way of actually addressing some of our priorities, and they are based on this. So this section comes from the NHS Constitution, and I used it as part of my presentation along with 4 of the 6 Cs when I was applying for this job. And the reason I'm showing it to you today is because I think it really encapsulates what we're here to do. It encapsulates what we're about. It talks about both mental and physical health, which I think is really important, and particularly with this audience. It talks about helping people to get better when they're ill, but also recognising that people don't always do that, and we have to be able to support people towards the end of their lives as well. It recognises some of the competence and the skills and the science of healthcare and our profession. But it was that last sentence that I think meant a lot to me, which is the one about, it touches our lives at times of basic human need when care and compassion are what matter most. And it was those 2 words of care and compassion that really prompted me to develop the 6 Cs. I also talk about this. This is a quote by Judith Shamian. She was the president of the International Council of Nurses, and this quote was released around International Nurses Day last year. And again, the point about this is it just really shows, and I think talks very clearly about, as a profession, we're the largest group, which we all know, but we're the only profession that are as close to people at all times, 24 hours a day, 7 days a week, often to those that are most vulnerable and the most difficult to access. And we do have a fantastic opportunity and probably quite a challenge to really improve the health of the population. So concentrating very much not just on an illness service, but a health service, and looking at the prevention agenda and the support agenda that absolutely enables us to be the very best we can be. You will know that, or many of you will know, that I published Compassion in Practice in December 2012, at the same time as we published the 6 Cs. And this is a 2-year-on report that was done at the end of last year. And the purpose of the Compassion in Practice strategy was to try and set out a 3-year plan for action that encapsulated various different areas. And included in that were things like improving staff experience as well as improving patient experience. We know that the correlation between the 2 is absolutely clear. There is very good evidence that says if you work in well-supported teams, that you feel enabled and empowered and supported, you are able to provide better patient care. Your experience as a member of staff is improved, and therefore your patient experience is also improved. We talked about staffing because of the critical issues that I think the country was facing in terms of not enough nurses to deliver care in many places, and we still don't have enough everywhere, but it is beginning to improve and the focus is there. And we talked about building and strengthening leadership, absolutely critical in terms of the role that we have as professions. All of you, whatever job you do, whether you are academics working in the university, working in the provider organisations, or as students, have a leadership responsibility. And as soon as you qualify and you're out there as an RN, you will be taking leadership responsibility for your patients, for their families, for assessing care, or assessing need, implementing care. Absolutely critical piece of work for all of you. This is a word cloud that I really like. How many of you either join or get involved in the We Nurses Twitter line? Yeah. So We Nurses held a Twitter chat around the 5-year forward view and asked, what do we think that means for mental health? And that was done in February, so last month. And this is the word cloud that came from that. If I'd been honest, if somebody had said to me beforehand, what would I have expected people to say, I would probably have expected there to be more in there around parity and prevention, and probably a little bit more about nursing or nurses and the nursing role. But I do think it's really interesting when you look at that. I'm still not quite sure where surgery came into it. But the really important point here is that there was a big discussion about health. Parity is fairly large. Mental is very large. Access, priorities, and forward. So I think that gives you some indication of the sorts of conversations that were being had on those We Nurses chat lines. And actually, I find them usually very, very productive and helpful. I also thought it would be helpful just to show you how one mental health trust has described how they might use the 6 Cs. This is the 5 Boroughs Partnership Trust, which is in the northwest of England. They have developed a culture of care. They have really embraced the caremaker model, the 6 Cs, and they have adapted it to do what they wanted in that organisation. And for me, that's the power of this. This is not me saying you have to use it, because I'm not, and I never have. It's about individuals and organisations saying, does it fit with the way we want to work? Can we use it to be able to articulate to our staff, to our patients, to their families, what's important to us as an organisation and what's important to you as members of staff and patients we serve? And they have adapted their own language around what each of those Cs mean. And they've involved everybody in that. It's not a nursing issue. It's not about nurses and, I haven't got midwives in that trust, but it's about the whole system. It's about the whole members of staff. And one of the things that was great is the chief exec. And he said, and I've just written down what he said. It's fantastic that our culture of care appeals to all our staff. And I think the exciting buzz surrounding the 6 Cs and the Caremaker initiative is really going to help make the culture of care come alive for everyone across the trust. I'm proud to say that I have myself been accepted as one of the first caremakers, and I'm committed to putting our service users and carers at the heart of every decision I make as a chief exec. And I just thought that's the sort of thing I wanted to happen. Somebody that would take on that leadership role, demonstrate it, live it, show those values. So again, it varies across organisations, but it's one example of how it makes a real difference. So what does mental health nursing mean to me? A few bullet points that I just think are really just important to me when I was thinking about it. It is a unique profession. The responsibility that you have as professionals, I think, really shouldn't be underestimated. We spend too much time talking about acute nurses, acute hospitals. I am an acute nurse by background. I'm an adult nurse. But I think that you have a fantastic and unique opportunity to make such a difference to the lives of so many people. It is an ever-expanding role. There's a lot more independency now, a lot more advocacy in mental health roles. There's a lot more of independent working, being part of teams, but also taking responsibility and actually having really good working relationships with patients and the people that you serve. Doing quite a lot of work around the equality and stigma area. There is still, and I've got a couple of pictures later, there is still too much of a stigma associated with mental illness, and we need collectively, every one of us, I think, to try and address that and demonstrate that actually it's not, and to allow people to talk about it, to be open about it, and to listen to what they say. Using personal stories to be able to explain not only why you go into the work, but using the personal stories of people that you serve in the same way as we heard that fantastic story about May earlier, actually makes it meaningful. theory is brilliant, that is absolutely what we need, but when you relate it to practice and you relate it to people and the stories of individuals, that's a significant factor, I think, in us our being able to move on. And yes, as you heard earlier, you are the future of our profession. The roles that you play now and what you'll be playing in the future will make sure that actually we're able to deliver what we need to deliver. There has been quite a lot of work done, and I'm just going to whiz through some of these things really quickly because I think you probably know most of them, and if you don't, I was going to put my watch is now sliding down the that's it. No, it's at the bottom now. So this is some of the really key things that we're doing. How many of you have heard of the Friends and Family Test? So a few. The Friends and Family Test has been in place now for well over a year. And we've had about over 5 million people that have responded to the questions. And the questions are to service users. And it asks the questions, would you recommend this service to your loved ones? It's been rolled out now into mental health. It started in January, and at the end of March, as you can see there, March 27th, we will publish the first set of months' data. Those that have used the Friends and Family Test in acute hospitals and maternity services will say that it can provide a really good way of understanding what people are saying very quickly. So it is done at a fairly granular level. So if you work in a particular ward or a particular service, you get information and feedback about that ward or that service. And that in some ways has got to be more means that you can be much more responsive than perhaps waiting for an annual survey. The annual survey may be more detailed, it's very useful, but the impact I've had, certainly the conversations I've had with people before have been along the lines of, yeah, but that was a year ago. The annual survey was done such a long time ago. We've now moved on. And then you wait another 6 months for the next annual survey to be published, and it's the same issue, and they get the same response. Whereas when you get something on a monthly basis, you are able to adapt, to change, to reflect, and to make change really quickly. And we've got some great examples of that, and something like about 78% of people that did gave us some feedback said that they had proactively used feedback in FFT to make changes. So when it comes out, encourage you to look at it, to use it, to be involved in that. We've also set some new access and waiting time standards, particularly around early intervention in psychosis, around eating disorders, and particular IAPT. There's some challenges sometimes when you talk about standards and targets, but we know that the focus that people spend on delivering against sets of standards that are set up to be, something that's important, does actually have quite an impact in terms of the way organisations respond. And the important thing is doing it in the right way. This is not about hitting the target and missing the point. It's about thinking about how you provide services that people need. Most of the input and most of the work to see people more promptly is based on the evidence that it does actually make a difference. We've expanded choice in mental health. Choice used to be available in physical health, but you didn't have any choice of which hospital or which service you wanted to go to if you had a mental health problem. We've done much more work on, for example, the patient safety thermometer in mental health. That will give you a prevalence survey which looks at a variety of key areas measured every month, so things like the use of restraint, self-harm, etc. Lots of things that were really important to patients will for the first time enable you to publish and look at what's happening. And we're doing work on the mental health staffing guidance. You'll know that we've published that for acute hospitals, and NICE are doing that work now both on mental health in community settings but also inpatient settings, and that will be published fairly soon. So the Health and Social Care Information Centre, I just thought, you may know this, but I just thought it would be useful just to put the scale of the issue. So we know that 1.75 million adults access specialist mental health in the last financial year. The mortality rate for those with a serious mental health is 2.4 times higher than the general population. So the work we need to do around the physical health of people with a mental health problem really can't be underestimated. There are far too many people with a mental health problem dying early, often due to cardiac issues, respiratory issues, people who smoke, maybe take drugs, But it's a classic example of where people concentrate on one part of a patient's or a person's needs without thinking about the whole person and the whole health needs. Things like the prevention agenda is going to be so important. How many mental health organisations are completely smoke-free at the moment? Very, very few that I know of. There's also a significant number of people aged 18 and over with depression and a massive amount of use of antidepressant prescriptions. I told you I was going to talk a little bit about Stigma, and these are two very, very well-known people that have been very open about mental health issues. So Stephen Fry saying, 1 in 4 people like me have a mental health problem, but many, many more have a problem with that. And Ruby Wax, who I think always does something with a bit tongue in cheek. 1 in 5 people have dandruff, 1 in 4 people have mental health problems. I've had both. So you can say, what does that mean? Is that belittling it? No, it's not. It's actually putting it into context and actually saying there's nothing to be ashamed of and we need to talk about it. We know that the age of onset for lifetime mental health disorder is critical. So for me, the work we're doing with children and young people at the moment and the work that you will be doing in the future I think is critical. So by the age of 14, 50% of people that end up with a lifetime of mental illness, excluding dementia, has started by the time they're 14. By the time you get to your mid-20s, it's up to 75%. So actually working with children and young people early and starting to recognise that there's a problem and do something about it will have a longer term effect on our ability to treat people. And in a recent survey where we had 13,500 users that took part in the survey, they talked about the areas of positive experience and areas for improvement. And I'll only talk about these very briefly. But the important thing is they did say that what was positive was the relationships with staff, the fact that staff listened to them, that they were being treated with respect and dignity and being given enough time for discussion was actually quite positive, as was organisation of care and services. Now, I was quite surprised about that because when you talk to people and you talk to families and carers, they will often tell you that the organisation between different services is really poor, access to knowing who to contact and actually having time to talk about their problems is also quite an issue. So I was pleasantly surprised that was something that was done this time last year. However, the areas for improvement are ones that you would expect, I would think. So crisis care, too many people admitted because there isn't enough support or enough support when they are heading for or in crisis. Making sure that they're really involved in decisions. These decisions are not done to them, that they are actively engaged and supported. And making sure that they have accurate information about the drugs that they're taking, the side effects, what does it mean? Is there any other way that they can be managed or supported? And this just shows you some of the details around that positive relationship. On average, about 7 out of 10 people rated their services as pretty good. 60% said they were definitely given enough time for their needs. 90% felt their care was very well organised, and the correlation between that and their overall experience is shown in that figure 1 there. So some positive figures out of that survey. But there was also issues about contacting. So these figures, 78% and 42% don't make 100. But what is in there is that they're saying that some people know who to contact, but then can't. So there's an issue there about you might know who to contact who's in charge of your care, but actually being able to do it and knowing how to get hold of them are two very different things. And it does vary as well between the age groups. So if you're younger, so between 36 and 65, and that for me is still young, perhaps, you have to say 75% know who to contact, but actually over 65 it's a lot smaller. And we're going to show a film now which just talks a little bit about the nursing contribution and the importance that makes. And I thought you might find this just useful. It also means I can stop talking so you don't have to listen to me for a bit.
General nurses are dealing with health crises that are on the surface. They are they're visible, often they're external, and even if they're internal, you can cut into it and see it. Whereas mental health nurses, by definition, are dealing with stuff in your mind which is completely invisible. It is the only way of accessing that is through communicating.
I worked with this man called Graham, that wasn't his real name. He started to hear voices, he had strong paranoid beliefs that people were talking about him. He had to come into hospital, and the main way of actually helping overcome that loneliness and isolation as a result of his experiences was to really enter his world, to develop a shared model, a shared understanding of how these experiences shaped his beliefs and how that made him feel both emotionally and how he reacted behaviourally by avoiding a whole range of situations. It makes me feel really good actually, and it gives me a tremendous source of satisfaction that actually by relating to somebody, by understanding somebody, that you can actually empower them and help them recover. Without the benefits of professional help, Graham would still be stuck at home, he would still be experiencing rather distressing voices.
So what may sound like and look like just a very low-key conversation is often a very highly skilled therapeutic intervention.
I met Jo in the secure service, and at that time she was very unwell, and she was suffering from schizophrenia. She was very disturbed by voices. Eventually, we got to a stage where her symptoms were under control. Sometime after that, we were looking for an advocate for a new women's service, and Jo came to mind, and I recontacted her and asked her would she be interested, and eventually anyway she came to work with us. She said that's what kept her alive, that's what kept her going, that somebody had hope and a belief that actually things could get better. So I think one of the most important things is holding on to that hope for people when everything feels so hopeless.
One of the most helpful descriptions of how mental health nurses work with patients is about being alongside them. And that sounds almost passive and almost simple, but it is enormously demanding and complex and requires a whole batch of both professional and personal qualities.
There was a lady who had late-stage dementia. She was totally dependent with all her activities of living. You know, she needed feeding, she needed help with dressing, and she hadn't spoken for at least 10 years. She suddenly just spoke to me in the bathroom while she was in the bath. I was actually quite shocked, and she just said, "You've always been nice to me. You've always been respectful and loving to me." She said, "I'll never forget you." And then she died 2 days later.
Well, for me, mental health nurses are really at their most heroic when I have gone into meltdown and I've just lost all perspective and all hope and all motivation, and I just want out. The extraordinary thing that they're able to do is bring me back round so they can enable me to see things back in perspective and to feel optimistic that although things are rough, that they are copable with and survivable and ultimately enjoyable. Well, it's very unfashionable to say they're angels, but I think they are.
So yeah, that was, I didn't expect that at the end of the first time I saw it when she said about the angels, but anyway, I just think that does, listening to people that have used services and also staff that have provided those services really does encapsulate what we do. And the reason I've got this picture up is not because I wanted to show you him in a smart dress and high heels, but the issue here, this is the Compassionate Care Award at the HSJ Health Service Journal Awards last year, and this was given to South West Yorkshire Partnership Trust for the work they've done around their Creative Mind programme, which is about using art in different ways, art, sport, recreation. And the lady that's there in the black dress holding the award is a patient, was a service user who had multiple admissions on significant amounts of drug therapy, who was basically told by her consultant, the chances are you're going to continue to do this, I don't really see much of a way out. And one of the senior nurses that was looking after her and working with her had suggested using art and therapy, and she now works for the trust. She is no longer, she's off medication. She has had no admissions for some considerable amount of time. And the purpose of that is actually working with and alongside patients and thinking about different ways of supporting them has had a massive impact both for her and now for many other patients in that organisation. We also want to celebrate great practice, and that to me is a really important way. And we do every month we have 6 C's in action and celebrating excellence. And for November, in both December and January, the winner was in mental health. And this is the Together Trust, which is in the Southwest, where the practice education facilitator wrote a student's charter based on the 6 C's. Not because we asked him to, but because he thought it would be a good way of doing it. And the results of that has increased the quality of placements and sets the expectations around what standards should be met, both for care and service users. And I think that was a really positive thing, and he was very chuffed to be given that award. We've also got a 6 C's live mental health community. So if you're interested, signing up to that, looking at being able to join that community online, see what happens, good experience, good practice, please do that. And I wanted to just end with a quote really, which I like using quotes, and I try and vary them so people don't I don't say the same ones, although I was very minded by Professor Brooker's quote earlier when she said people remember how you made them feel, and that's actually, that end is based on a quote from Maya Angelou, who said people will forget what you say, they'll forget what you did, but they'll never forget how you made them feel. And this one by Atticus Finch, which is In To Kill a Mockingbird, you never really understand a person until you consider things from his point of view, until you climb into his skin and you walk around in it. And I think that is something that is so true for this profession and also this particular field of practice. I would be not doing my duty if I just didn't pop up this Mary Seacole statue. Some of you will know that we are about, hopefully, to put a big statue to Mary Seacole in the grounds of St Thomas's Hospital in London. Mary Seacole was a Jamaican nurse who worked in the Crimea, extremely well known, and of course we are in the Mary Seacole building. We got a bit more money to go to actually be able to put that statue up, so I've put the Appeal logo there and the Twitter handle. So those of you that aren't involved might want to just log on and have a look and see what we're doing, getting that up. But I just thought it was too meaningful on the basis of the name of this building not to tell you what we're doing. So I apologies, but I just thought it was too important not to. And so thank you very much, and I'm happy to take any questions. We've got a couple of minutes, I think.
So if anyone's got any questions for Jane Cummings, feel free to ask.
Hi, thank you for coming to speak to us very much. I'm going to try and word this properly so I don't get all mumbled. Basically, I totally agree with 6 C's. I think they're a great initiative, and I'm trying to implement my care at all times, and I'm sure a lot of my colleagues do. However, one thing that I do seem to find a lot, I'm an adult branch, but I am very interested in mental health, is seems to be a demoralised situation between nurses and healthcare professionals. So earlier we had a lecture about our identity and our roles as nurses, but it's quite a confused state. And I think that's what causes some sort of, not a competition, but it separates nurses from doctors or even mental health nurses and adult nurses, child nurses, when actually we're a team overall. We should be working as a team at all points of our life and career. Is there any initiatives or anything that you know of which are trying to build this confidence as healthcare professionals, that we are in it all together, and that, you know, that we have care actually coming towards us as well from the big bosses up high and the chief exec boxes and stuff?
There's a couple of things. I think one is that, so when I talk about the 6 C's, as I said earlier, it's not about just nurses and that profession. It's about the whole system and the whole team. There's a couple of pieces of work that have been done. Last November, we published a document called it was about building and strengthening leadership, and it was called Compassionate Leadership, and it talks in that about the evidence that supports you as an individual, as a team, or as an organisation to really look at providing compassionate leadership, and within that there's a lot about how we look after each other and how we support each other. And I've come today from Birmingham Children's Hospital, where they were talking about what they've been doing around that team approach and about looking after each other. So that's one thing. The second thing is we're about to launch next week the Cultural Barometer, and the Cultural Barometer is another survey, but it's a barometer of how people feel their environment is, and within that there's some specific pieces of work about teams. So it's not just about how you work as a group of nurses, but it's about how you work as a team across other professions. And I think that potentially will give some quite important levers and support to be able to do what you said, which is to identify some of the issues around team working, but then to look at how you can improve it. So that's just a couple of ideas that might help.